So, what happened to Asperger syndrome, and how is it related to the current conversation about autism as related to the US in particular and mental health? Hi, I'm Dr. Josh, Chair and Professor of Marriage and Family Therapy and trained clinical neuroscientist. Now, the term Asperger syndrome is still sometimes used even today, despite the fact that it has been removed from the DSM, the Diagnostics and Statistics Manual, used for diagnosing mental health disorders. And it refers to a syndrome that was described as a neurodevelopmental disorder for individuals struggling, in particular kids, with social relationships, picking up emotional cues, various patterns of behavior that now we associate with the broader umbrella term of autism. And so the syndrome was named after the Austrian pediatrician Hans Asperger, who first noticed and described this particular syndrome. But over the years, it became clear that Asperger's was simply a subtype of autism, a broader syndrome that had the same descriptive criteria, just with different levels of support needs for different people. And so as diagnostic criteria were updated, it became obvious that putting Asperger's into the autism umbrella and then redescribing that as lower support needs rather than higher support needs made more sense and was more statistically valid than having them as separate. Combine that with some of the political issues with Asperger himself and a relationship to Germany in the 1940s, and it became even more important to get rid of this particular name for a subtype of autism. So fast forward today, now the autism umbrella includes Asperger's along with a number other of previously separate diagnoses, and so we see the overall number of autism cases going up, even though if you looked at the combined numbers across all the previously different diagnoses, you wouldn't see as striking an increase. But that supposed increase, that's again not really an increase, has led to political statements about trying to understand this unexpected and confusing rise in cases. But it's not an unexpected or confusing rise at all. It is simply a matter of better, more accurate, and more specific diagnosis.